Okay, so we arrive on scene. The first thing we're going to do is make sure the scene is safe and we have our proper PPE. We do, we're good to go. So we're going to get our general impression of the scene, first of all. And we see one patient. She appears to be about a 70-year-old woman, and she's fallen down the stairs. So right away, we're going to, I'm going to have a partner attempt to hold C-spine while we make contact with the patient, try to get her level of responsiveness. Ma'am, can you hear me? We're the EMTs, can you hear me? No response. I'll try painful stimuli. I'll try trap pinch, nothing. Sternal rub, nothing. Okay, so we're going to assume this patient is unconscious, unresponsive, secondary to a fall. So we're going to call an ambulance and assume she's a critical patient, transport as soon as we can. Now we're going to go into the airway. I'm going to check her airway, and appears to be patent. I'm going to apply an OPA, and then I'm going to simultaneously, if she accepts it, and she does in this case, so now I will simultaneously check her breathing and circulation. I will feel for air with my ear, and then look for a good chest rise and fall while taking a carotid and radial pulse. And I am feeling a weak and rapid pulse. I'm not seeing any chest rise and fall or any breathing at all. I'm not feeling any air. So I'm going to have a partner with the OPA apply high flow oxygen at 15 liters per minute. And we'll supplement that with a bag valve mask at 1 breath every 5 to 6 seconds. Now going back, so if we have that under control, we're going to go back to her circulation. Like I said, her pulse was weak and rapid. Her skin was cool and clammy, and she had delayed capillary refill. So now I'm going to do just a quick blood sweep to make sure there's no obvious injuries or additional that we can't see, I haven't seen. And then from there, I will have a partner take a baseline set of vitals. And in this case, we're going to get a set of vitals, and we'll also get a sample history if there's a family member around. And in this case, we're going to say the patient's blood pressure is 80/50 with a pulse at 135, and it's weak and rapid, like I said. So we're going to treat this patient for shock. We're going to cover with a blanket, keep the oxygen flowing, and then transport as soon as possible. If we're waiting, I'm going to begin my rapid secondary trauma assessment. I'm going to start at the patient's head, checking for any blood, scrapes, cuts, any other obvious damage. Nothing up top. Going down forehead, good. We're going to check her eyes with a light. Pupils appear to be a little dilated, expected. And then going down to the nose, looking for any blood or other fluid. We're clear. Check the ears for fluid. Nothing there. Going down mouth. Her OPA is still intact. We're still good to go. Going down to the patient's neck, we're going to check for jugular vein distension and tracheal deviation. Not present. So we're going to keep going down. Collarbones are intact. The patient's chest and sternum is intact. Chest going down to the rib cage. All good. I will palpate all 4 quadrants of the patient's abdominal muscles. Good to go there. I will check the patient's arms for blood, any kind of deformities, nothing. Checking for pulses, make sure they're still present. They are. I'll go to the patient's groin region, looking for any kind of bodily fluids, anything like that. Nothing at this time. So make sure the pelvis is still good, intact. I will go down the right leg, feeling for anything, nothing obvious deformities. Feeling for a pulse. It's still there, weak, but it's present. Ma'am, can you push down on my hand if you can hear me? No response, no, did not follow commands. I'll go down the left leg, same thing. Feeling for pulse. Ma'am, can you push down on my hand? No response. So at this time, my partner has already applied a cervical collar. So at the heads count, we're going to rotate the patient up towards me to check the backside. So on them, 1, 2, 3, rotate up. Whole patient would be up. And then I'll check the backside, back of her head, back of her neck, her back, the whole back, backside, back of her legs. And nothing is obvious, no deformities that we can see or haven't already seen. So now at this time, we're gonna rotate again on the heads count back onto a backboard, which we'll slide in. So get that in there, and then ready, 1, 2, 3, back down, secure the patient to the backboard, the straps, cover her with a blanket, and keep reassessing this patient every 5 minutes while transporting, and keep the oxygen flowing, still 1 breath every 5 to 6 seconds, and transfer the patient as soon as you can.